We're here at the IAS meeting in Kuala Lumpur with Mark Barone, who is with Engender Health from the States, from New York City area. And you are going to be talking about a ring device for circumcision, which has been, well, I'll let you explain it. Get the background on this and so forth, the need and so forth.
So let me start by just talking a little bit about circumcision generally. There's very solid evidence that circumcision is a very good protective measure for men in sub-Saharan Africa, with a reduction in risk of up to 60%. So, and there's good evidence from randomized studies to indicate that. And so there has been a lot of effort put into rolling out circumcision in many sub-Saharan African countries. One of the issues is, though, that the circumcision procedure in adults is much more difficult than in infants. And right now it's mostly adults that need to be, that are interested in being circumcised. Although the idea is to try to move down into infants so that 10 or 20 years from now there are not many adults that need to be circumcised, since the procedure is technically much more difficult. And with a traditional circumcision, or a conventional circumcision, let's say the time is somewhere between 15, 20, and 40 minutes. There's a fair amount of bleeding that occurs, and there's a lot of stitches, a lot of suturing that is necessary.
In an adult?
In an adult. And so we have been studying this device, which was developed in China and is commercially available in China. It's been used in about 500,000 men and boys, so it can be used in men as well as boys. We've been studying it in Africa. We started in 2007 with just a very small pilot study, and we've done a series of 3 additional studies, including the one I'm talking about, or the one that I'm here at the conference to talk about, which was a large demonstration study. Should I show you the device?
Yeah, I think that we want to see the device and how it works, okay?
So I don't know.
I'll hold.
Or you'll hold the pin. So this is the device. It includes an inner ring and an outer ring, and we have this training model here that's used for training people. And so the inner ring goes over the head. This is actually a tiny bit small for this penis, I'm afraid, or this model, I'm afraid to say. So it seems like it's a little harder to put on than it is. But so the penis goes on the ring goes on the penis just like this under the head of the penis, and then the foreskin is flipped back over the ring. The inner ring, and then the outer ring is put on and clamped over the inner ring. So this provides the occlusion so that there's no
excessive bleeding.
No bleeding. I don't want to shut it all the way because then I can't take it off again. And then the foreskin, so you can see the foreskin is hanging down underneath, and it is removed. I guess let me shut it all the way. So the foreskin is then cut off underneath, and the device stays on for 7 days. And then the men return to the clinic at 7 days and have it removed.
Can you talk any more about the issues around unintended consequences and so forth? There's any?
Sure.
Cover that.
So one, I'll put that back over there. So there's a lot of concern of people feeling like, what happens when the man gets an erection with their ring?
I was
you were perhaps thinking about that. What happens when the man gets an erection with the ring in place, and does it strangulate in some way and cause any problems? And it doesn't at all. There's a measurement. We didn't do it, but you would have to measure to decide which size of the ring to use. And so there's a leeway there so that there are no complications related to that. So the men keep the ring on for 7 days. While they have the ring on, there's some pain, just like there would be with a normal circumcision, but it's tolerated by most men. And then when the ring is removed, it's not completely healed, so it still takes up to the 6 weeks, similar with conventional circumcision, for the healing to occur. And there are potential complications that occur, although they're a little bit different than the kind that occur with the conventional circumcision. We did a large randomized study where men were randomized to circumcision either with the ring or with conventional methods.
And what's the conventional method?
Well, the conventional method, we did it in Kenya and Zambia, and in Kenya it was something that's called the dorsal slit, in Kenya it was the forceps guided method, and in Zambia it was the dorsal slit method. Those are methods that are recommended by WHO for adult circumcision.
So they both have the same healing time? because it's just a matter of healing the skin, the same.
The healing is a little different. It seems like with the ring, it's about 5 days, on average about 5 days longer. It's a different healing process when the sutures are used to bring the edges of the skin together, as opposed to with the ShangRing, the healing is more like if you were to cut yourself and not get sutures in it, it has to sort of fill in.
Gotcha.
And so it looks different as it's healing, and based on our data, it takes about 5 days longer on average, although some men heal sooner and some take a little longer.
So the implementation process here, or the approval and so forth, it's been approved in the U.S.?
It has been cleared. It has FDA clearance, is what it's called for this kind of a device. It has FDA clearance. And it's in the midst of the process for what is called WHO pre-qualification, which is the process where the WHO would then add it to the list of recommended approaches for circumcision. The manufacturer's facilities are being inspected for 4 days, beginning on the 15th of this month, the facilities in China. And we have submitted all sorts of data from all of our studies, and so hopefully by the end of the year there will be some pre-qualification, or the pre-qualification will occur. So with this device, though the procedure takes about 5 to 7 minutes, there are no sutures that are necessary, and there's essentially no bleeding. So it's much quicker and easier, which means a broader range of healthcare providers could provide the service, and so we think that this could help to scale up.
That's what I was going to ask. What would be the criteria by which you would have the person implementing this? Would be, physician, nurse?
In fact, many circumcisions in sub-Saharan Africa are already done by nurses and a level of provider that's called a clinical officer. It's similar to a physician's assistant in the United States.
Okay.
And currently many circumcisions are already done by those levels of staff. Some countries require or allow only physicians to do surgery. And so one hope is that the definition of surgery usually requires or involves suturing, and this device doesn't involve suturing, and so it's possible that nurses in those countries would be able to do it.
So it might expand the potential for getting someone less qualified, less elevated,
less skilled. Less
skilled.
Surgically skilled.
Yeah.
In our studies, most of the procedures were done by nurses and clinical officers, because the countries we worked in already allow circumcision to be done by those levels of staff. And so it does not require a physician. It also does not require any sort of specialized operating room. In fact, some of our circumcisions were done in schools or town halls that were temporarily being used during an outreach activity where the providers went to an area that didn't happen to have a health clinic, and men came to those non-healthcare facilities. So it can be done in a wide variety of settings.
Do you know anything about the background on this? Because I know there's certainly evidence that in Africa, sub-Saharan Africa, was more, the 50% benefit was evidence there. But do you know if any other research has been done in more developed countries about the usefulness of? Because that would be probably another thing that we ought to investigate.
Right. There has not been a lot of research. There has been, some people have looked back at data related to HIV transmission and whether men are circumcised or not circumcised, and tried to make some conclusions. That protective effect, the transmission route in Europe or in the United States tends more to be with men who have sex with men, and often that transmission is through rectal intercourse. And so one wouldn't necessarily expect the same protective effect as has been seen in Africa, where the men are at risk through the vaginal sex. The men in the U.S. and Europe and Australia that tend to get infected are getting infected because they're the receptive partner in the anal sex, and so whether they're circumcised or not is sort of immaterial, basically.
Well, I really appreciate you taking the time to visit with us on this, because it's rather interesting. And
Thank you.
hopeful that there's going to be some development and maybe movement on this, because every opportunity we get to reduce the incidence of AIDS is yet another milestone.
We're hoping that in the near future, this device will help to scale up circumcision to many, many more men who are interested in it.
Great. Well, thank you so much for being with me.
Thank you very much.